Well, good afternoon, ladies and gentlemen. We're going to kick off with this afternoon's panel. Just waiting for a few people to sit down. Okay, so welcome to the Philanthropy's New Directions and Strategies panel. Today we have 5 distinguished panelists that will be discussing from their perspective and from the organizations the new direction and strategies in their either foundation, philanthropy, or donor organization. I'll first introduce the topic, and then we will introduce our panelists. The panelists will then give us an introductory statement on the direction and the strategy of the organization. And we'll go one after the other, and after we'll get into a discussion. So to introduce myself, I am Kojo Loko. I'm a senior faculty member in the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. I serve as the Executive Director of the Challenge Initiative and also a Deputy Director of the Bill and Melinda Gates Institute for Population and Reproductive Health. So with that, I'd like to introduce our first panelist. And she is Althea D. Anderson, and she's a Program Officer, Gender Equity and Governance, William and Flora Hewlett Foundation. So Althea serves as a Program Officer in the Gender Equity and Governance Program at the William and Flora Hewlett Foundation. In this position, she cultivates partnerships to support local designed and led initiatives to expand women's reproductive justice, economic agency, social well-being in the Africa region. As a social scientist, she has examined links among intersectional identities, structural inequality, and health. Althea spent 15 years conducting research in sexual and reproductive health and rights, women's empowerment, male engagement to advance gender equality and youth development in the US and in several African countries. She has published, lectured, and presented on gender and sexuality, intersectional approaches to study of inequality, and equitable philanthropic practices. Welcome, Anthea. So over to you.
Kojo, thank you so much. Since this panel, I'm here with my peers, is for you to learn a bit about our strategic approaches in our philanthropy. I will share that I am a member of the Gender Equity and Governance team, and I co-lead our work on global reproductive equity and women's economic empowerment. Our global reproductive equity strategy started a refresh right at the beginning of the pandemic, literally in March 2020, and launched our new strategy in September of last year. I could share with you the process of that strategy refresh, but what I would like to do now is to share a video with you that gives you a really great overview and a real fun overview of our new strategy.
For more than 5 decades at the Hewlett Foundation, we have committed ourselves to expanding access to contraception and safe abortion so women can pursue their life aspirations, including if or when to have children. There has been significant progress towards improving sexual and reproductive health and rights around the world in recent decades. However, acute inequities persist, especially for those who face intersectional challenges along age, income, education, disability, and geography. Our new global reproductive equity strategy places emphasis on the development of policies and systems to reach women and girls facing the greatest barriers in East Africa and Francophone West Africa. as we aim to shift resources and power to African institutions and social movements that are best positioned to drive long-term sustainable change in the next 5 years, we will work with our partners to strengthen local ecosystems to advance policies, systems, and practices that support sexual and reproductive health and rights through investing in African civil society organizations, feminist movements, and research institutions. Catalyze support for access to safe and legal abortion as an integral component of reproductive health and rights. Support locally driven service delivery innovations to reduce inequity in access to contraception and abortion care. Support African narratives that promote gender equity and sexual and reproductive health and rights by investing in African artists, activists, and social influencers. We believe that in the next 5 years, African women and girls will further their well-being and life aspirations through the leadership, expertise, and collective efforts of African movements and organizations. Learn more about our strategy to advance reproductive health, rights, and justice at hewlett.org.
Thank you. I'm sure during our discussion, I'll have a chance to share a bit more and give you some details about the different outcomes under this strategy. But during this introduction, I'd like to share that given that we went through this process during the pandemic, in some ways it was more challenging than a normal strategy refresh process. It took a long time working remotely, but there were also advantages. In this refresh, we had an opportunity to really allow for partners who really work at the grassroots level, who are most impacted by the work, to be able to join the conversation and to inform our strategy because everyone was working remotely. And we really feel like this strategy is in response to a lot of what we learned through this process. And I'm happy to share more during our discussion.
Thank you, Althea. Yeah, we're looking forward to hearing some more. So permit me to introduce Ann Stars. Ann is the Director of Family Planning at the Bill and Melinda Gates Foundation. And Ann Stars leads the family planning team's overall strategy and coordinates with other global strategies within the foundation and external partners to achieve greater access to voluntary family planning. A widely recognized expert and advocate for gender equality and reproductive and maternal health, Anne has published numerous papers and commentaries on global and domestic health policies during her 30 years in the field. Welcome, Anne, and we would like to hear about your strategy at the Gates Foundation.
Thank you, Kojo. It's a pleasure to be here and to have the opportunity to share a quick overview of the Gates Foundation Family Planning Strategy. So the strategy was approved. We also went through a fairly lengthy refresh process, so gave me a little bit of PTSD there. The Gates Foundation Family Planning Strategy was approved in January of 2021, so we're almost 2 years into execution. And this strategy was based on a set of key analytical approaches. So we looked at, first, what does the field need? What are the key bottlenecks? What are the key barriers? What are the key opportunities in the space of family planning that can help drive progress? The second key element that we looked at is, what is the foundation good at? What is our comparative advantage when we look at other donors in this space? And then the third key element was looking at that more specifically, what are other funders doing and where can we, either by complementing what other funders are doing or by collaborating with them, can we help, again, drive progress? So the strategy is focused specifically on family planning, on increasing access to quality contraceptive information, counseling, and services. Geographically, we focus on a set of what we call deep engagement countries, so that's Ethiopia, India, and Nigeria. Our other focus geographies include Kenya, Pakistan, and Francophone West Africa. The budget for the family planning strategy is $280 million a year. And then in terms of what we work on, what we fund, the first big area is contraceptive technology R&D. The Gates Foundation, of course, was founded by technology money, and so that's a strong component of much of our work in the global health space overall, and that's reflected in the family planning strategy. So we support R&D to develop new and improved contraceptive methods, and that work on the contraceptive methods is shaped by deep research into user preferences or non-user preferences, as the case may be. What is it that women value most? What is it that's most important to them? What is it about contraceptive methods that are driving high rates of discontinuation or are preventing women from even starting to use a method in the first place? So that's the first big component of what we fund. The second is to look at what are innovative approaches on both the supply and the demand side for contraception that can help drive progress, drive new ways of working, new ways of thinking in the field. So a couple of examples of that are working on supporting the work of the role of the private sector, in particular drug shops and pharmacies, in increasing access to contraception through channels that are more convenient, that women often express preferences for, particularly young unmarried women may feel more comfortable going to a local drug shop or pharmacy than going to a health facility where they have to wait a long time, where they may run into somebody, their own mother, their auntie, a neighbor who could potentially make them feel stigmatized. The third area that we work on is on scaling proven high-impact practices in family planning. So this is a key area where we work with partners like UNFPA, the World Health Organization, the World Bank, as well as, of course, USAID, FCDO, the UK aid agency, to look at what are proven high-impact practices like post-abortion family planning, postpartum family planning, task sharing with community health workers, and what can we do to support the scaling of those high-impact practices in both our key geographies, but also more broadly. And that work in those three key areas is also supported by work on data to improve data collection, data analysis in the space of family planning, and then by advocacy work as well. So that's the very top line summary. Thanks, Kojo.
Great, thank you, Anne. And again, we look forward to hearing a bit more. Miles. So let me introduce Miles Kempley. Miles is the Executive Director, Sexual and Reproductive Health and Rights, Children Investment Fund Foundation, CIF, as we all know. Miles is the Executive Director for SRHR at the Children Investment Foundation. Miles has led CIF's approach to SRHR for the last 10 years, including adolescent SRH. Self-managed SRH, product innovation, and the Foundation's thinking on demographic transition. Today, CIF's SRHR portfolio has active grants over $400 million. Miles started his career in the private sector and has worked as an advisor to governments and led social business. Prior to CIF, Miles worked for SRH programs in low and high resource settings. Welcome, Miles. Let's hear from you.
Wow, thank you, Kojo, very, very much, and hello, everyone. So I'll start with a quick intro to CIF, then what we've focused on SRHR, but I'll end with sharing a bit about where we're going. So for those that don't know us, CIF is a UK-based private foundation founded by Sir Chris Hone 20 years ago. Chris is one of the world's most successful investors, and he set up the foundation to confront fundamental injustices that led to hundreds of millions of children having their futures predetermined simply by where they were born. The foundation was also built on applying best business practices and entrepreneurship to solve problems. And one of our mottos is that CIF exists to solve problems rather than just make grants. So today we are a 200-strong foundation team based out of 5 offices: Addis Ababa, Beijing, Delhi, London, and Nairobi. We are striving to diversify and localize, with most of our programmatic and support staff coming from our priority countries, unlike myself. We have invested in SRHR for almost 10 years, and it is one of CIF's top priorities. As Kojo says, an active portfolio, large active portfolio, but we're dispersing approximately $90 million a year. To put this into context, it represents about 20% of the foundation's annual giving, with our other priorities including issues such as climate change, nutrition, child protection, girls' education. Our SRH goal is to improve uptake of choices to dramatically reduce unintended pregnancy, unsafe abortion, and HIV infection, meeting individual needs so that they can reach their full potential. Our geographic focus is and will continue to be on the poorest communities in sub-Saharan Africa and India. And since our original strategy, we are probably best known for our focus on the SRH needs of adolescents and young people, our belief in individual bodily autonomy, where our support for self-managed care includes product innovation, policy work, and demand side, and our championing of youth activism, meaningful youth engagement, and youth-led movements. Whilst these approaches have delivered exciting change, and which we're seeing here at this conference, they've also led us to evolve our approach. And I would like to highlight 4 things that you should see more from us. The first is a deeper commitment to equity at scale. We're frankly very worried about how funding shifts are affecting frontline access to reproductive rights, especially for the most marginalized. You will see us focus more on the rural poor, on those who face the greatest barriers to access, on issues that are neglected, and on regions that are furthest from the demographic transition, such as the Sahel. Secondly, we are going to work harder for systemic change through new partnerships. Partnerships like SEMA Reproductive Health, which is supporting and enabling country-led leadership over local markets, or the work that we do to back the infrastructure needed to better coordinate action against opponents of reproductive rights, to preempt those tactics, tackle disinformation. Third is our commitment to localization, to diversify our partnerships and our thinking, making more decisions that are grounded in local knowledge and local leadership. And finally, fourthly, making more of our work gender transformative is central to our way forward. I want to reconfirm the commitment we made last year at the Generation Equality Forum that CIF will invest almost $500 million over the next 5 years in gender transformative SRHR and the human capital needs of girls and young women, where SRH is part of a holistic approach centered around girls' needs. For those interested in partnering CIF, we're not always easy. We are a foundation that works by co-creating solutions, by active management, by course correcting where needed. This can be tough, but this has helped us create enduring partnerships, and that's at the heart of who we are. So I would encourage you to get in touch with the CIF team and find out more. Thanks.
Brilliant. Thanks so much, Miles. So I see that we've come all the way from the United States. We've gone to the UK, and now we're moving to Asia. Okay, so CLD Gonzalez will be representing the Zuilig Family Foundation. CLD is the Strategy and Partnership Director for the Zuilig Family Foundation, ZFF. Prior to joining the foundation in 2013, she worked on projects with civil society organizations and bilateral development agencies on mainstreaming reproductive health sessions in the Philippines cooperatives, public financial management, universal access, and maternal and child health. In ZFF, she works with the operations team to craft with the 10-year direction of the foundation and develop partnership with other philanthropic organizations, national and local governments, and other development organizations to support the foundation's vision as a catalyst for better health outcomes in reproductive health and maternal and child health and nutrition. Zildi, take it away.
Thank you, Kojo, and good afternoon, everyone. So Zuilig Family Foundation is an Asian philanthropy, and we are a family foundation based in the Philippines, and our vision and mission is to become a catalyst for better health outcomes for all Filipinos. We do this by enabling effective leadership and governance in local health systems, and we work directly with local government units. Our operations are largely supported by the Zuilig family, with a $20 million commitment from 2012 to 2021, and we recently renewed our 10-year strategy, and we have received another round of $20 million commitment from the family until 2031. While we do have our roots in corporate social responsibility in 2008, we managed to become autonomous, and we established ourselves as a nonprofit family foundation in the Philippines. And this allowed us to work directly with local governments, government agencies in the Philippines, as well as development and other bilateral partners. The work of the foundation is rooted in the context of health inequities in the Philippines, which is largely influenced by geography and poverty. And with the enactment of the 1991 Local Government Code in the Philippines, it allowed the devolution of health programs to be implemented by local government units. Now, local governments in the Philippines are directly responsible for budget allocation and program implementation of health programs. And a lot of this actually meant that local governments should have the public management capacity to implement these programs. In most cases, a lot of local chief executives in the Philippines are often ill-equipped to manage health facilities and health programs, largely because they are political entities. And with that, the focus of the foundation looks into systemic health leadership and governance, really building the capacity of local governments to work and implement these programs. And our work is guided by our health change model, which looks at transforming leaders to enable them to improve health systems and achieve better health outcomes. And we engage local leaders to make sure that they're actually committed and ready to invest in health programs. And these interventions that we do include leadership interventions, leadership training, coaching, and technical assistance, and even technical mentoring. The foundation, as we work with some of my colleagues here, we do not provide capacity substitution, but we work with local governments to improve their capacity so that they can implement their programs themselves. And when we started in 2008, working with local leaders directly as political entities was largely a niche concept. So a lot of development partners in the Philippines actually work with health officers and health teams to provide technical interventions, and not a lot of them actually work on looking at adaptive issues such as team dynamics, capacities of local governments to manage resources, or allocate programs for health. When we piloted our program, we worked first with a piloting phase from 2008 to 2013. We worked with 72 municipalities, and as a result of our work in improving their capacities to manage local health systems, a lot of them were able to reduce their maternal deaths to zero, and several of them are actually able to sustain programs despite being low-income, poor municipalities with very little health budgets and internal revenue allocations. That work led to partnerships with the Department of Health and academic partners where we mainstream our technology and allowed us to reach 774 municipalities, 34 cities, and 27 provinces in 10 out of 17 regions in the Philippines. The lessons from our programs in this pilot and mainstreaming phases allowed us to focus on key interventions specific to universal health care, nutrition in the first 1,000 days, and adolescent sexual and reproductive health. And it actually showed a large set of inequities, especially in terms of access of girls and women in income-poor provinces and municipalities in the Philippines, largely due to policy and other societal and cultural barriers. Thus, as we scale up our work, we focus on areas of universal health care and local health system strengthening to look at the intersectionality of these concerns and integration points where we can build our philanthropy on. So aside from the family support to the foundation, the family is donating around $4.8 million to the University of the Philippines, Manila, to establish the Center for Health Equity. And as a foundation, we're also really looking at leveraging resources. While we do raise funds and we seek funds from other grants and from development partners, we're really looking at local government's capacity to invest for health systems, and we're looking at a leveraging counterpart of 1:2. So we hope that as local governments build their capacities, the actual investments for health programs are coming from the government and implemented by government. Thank you, Kojo.
Great. Thank you so much, Aseldi. And I look forward to delving a little bit more to hear about how you're partnering at other foundations. And I would like to hear from the other panelists too in terms of the kind of collaborations you have across board as donors. Allow me to introduce Tamara now. So Tamara Cranen is the director of the Reproductive Health Program, David and Lucille Packard Foundation. Tamara joined the Packard Foundation in 2012 as director of the Reproductive Health Program. Prior to joining the foundation, Tamara served as the executive director of Women and Population at the United Nations Foundation, where she designed and implemented initiatives to improve life for women and girls globally. With an emphasis on reproductive health, comprehensive programming for adolescent girls, U.S. policy on behalf of women and girls globally, Global South advocacy, and partnerships with the UN agencies. Tamara's experience in health and human services spans more than 25 years. She previously served as a consultant for not-for-profit and philanthropic organizations, including the position of interim executive director of the New York Regional Association of Grant Makers, whose members grant $4 billion annually. Tamara was also president and CEO of SACES, the Sexual Information and Education Council of the United States, where she was a leader in the National Dialogue on Sexual Health and Rights. Prior to SACES, Tamara served as the Director of State and Local Affairs at the National Campaign to Prevent Teen Pregnancy in Washington, D.C. There she developed and implemented a comprehensive strategy, a strategic plan for states and local communities to reduce teenage pregnancy. Tamara is the co-author of Girls Night Out, a book about women's group across America. Looking forward to reading that. She holds a master's in health services and administration from the School of Public Health at the University of Michigan. Welcome, Tamara.
Thank you. I didn't mean for you to read all of that, but fun to hear. Great to be here and great to be with everybody. So we at the Packard Foundation are in that point in strategic development that nobody really likes to hear about, where we have to say, sorry, we're planning our strategy. So what I would like to do is tell you a little bit about where we've been and what's on our minds as we go forward. And hopefully, come December, come January, we'll be able to tell you a lot more. So, as many of you may know, the Packard Foundation has been working on reproductive health since 1964. And we have focused on 3 issues: comprehensive sexuality education, contraception and family planning, and abortion. And we consider that a continuum of reproductive health rights and justice. When we think about what's critical, we look at young people. We think about them both as recipients of care and also as activists and movement builders. And we have also spent a lot of time thinking about quality. So of course we want to reach everybody. We want universal access for reproductive health. We want to assure that every single person, every woman, every young person is placed at the center of that care and really has a quality experience and is treated with dignity. So that's where we've been. We fund in the United States, and then we fund globally. We fund in sub-Saharan Africa and in Asia, particularly India. We've been in Myanmar, we're in Ethiopia, Rwanda, and Kinshasa, the DRC. And so as we think forward, we have a new mission, vision, and values at the Packard Foundation. It's not that different from our old one, but we're thinking a lot about the natural world, and we're thinking about just societies. And we have added a new value, and that's a value of equity. We're spending a lot of time thinking about justice and equity, and how we assure that we reach the most vulnerable, the most marginalized women and young people as we go forward in our next strategy. Now, I want to say something about that because we use those words, and I think we all do as a community, those words vulnerable and marginalized, and yet we really like to think of women and young people as having a lot of assets. So we're struggling with that language and trying to figure out a different way to talk about it. We are thinking about two things. We're thinking about the ability to create models to find innovation for the most equitable access to care. And in thinking about that, we're thinking about how we bring care closer to people. So that may be self-care, it may be the drug shops that were referenced earlier, maybe telemedicine. And as we think about that care, we think about choices for women and for young people, how to put them at the center of care, and we also want to make sure that we're attending to the nuances of their lives. We also are thinking about policies and systems and how we change policies so that they are for reproductive health, and how we make sure that policies are implemented and that there are budgets. And in doing this, we're thinking a lot about civil society. We're worrying about the opposition, which we believe is growing. And we are thinking about narratives. As we think about narratives, we're very aware that we have a long history of imposing on. And we want to make sure that the narratives are local, that they are creative, and that we're lifting up the voices of those most impacted. Those are some of the things that are on our minds as we go forward and that we can expect to be in our strategy. We are looking at the places in the world where there's the greatest youth population and the greatest youth population reaching reproductive age, and that's sub-Saharan Africa and South Asia. We are thinking a lot and exploring East Africa, West Africa, India, Nepal. But that's all exploration and early days of thinking. I want to say a few words about how we work. We tend to believe that it's critical to keep our ears to the ground, to look at local context, to look at evidence, and then to go back to our values. So always back to a value of humility, of integrity, and of real respect for the people who are most impacted and listening to their experience and their lives. We tend to fund locally, and we tend to have local advisors where we work so that we can do some work beyond the check, so that we can help convene, help work with government, and help build local organizations and give voice to local leaders. We also undergird our local funding with regional support and with global support, and we hope to think about it as a top-down, bottom-up kind of work. We think we learn the most locally, and it gives us credibility, and at the same time, we think it's critical to have global processes such as World Health Organization guidelines that then impact governments. So it's a bit iterative. We're excited to share our strategy going forward, and we understand that tomorrow our new goals will go up on our website, and hopefully in January we'll have much more to share about what our trustees confirm as our next strategy. Thank you for having me here.
Thank you, Tamara. And I'm sure it's quite a relief to quite a lot of people as they've been waiting for that strategy to come out. Bits and pieces of it has leaked out, though, so we're looking forward to it. Let's get into talking a bit amongst ourselves. And let me start with Althea. Althea, your GR strategy decided on a shift in focus to SRHR, ecosystem strengthening. What does it take to build and maintain strong ecosystems?
Kojo, that's the question. I can share that shifting towards SRHR ecosystem strengthening is a new approach that we're taking under our global reproductive equity strategy. It is something that arose during the refresh process as our partners, which includes grantee partners, peer funders, other stakeholders in the field, shared that national and regional organizations and actors are better able to serve the reproductive health needs and aspirations of all women and girls if decision-making, resources, and opportunities for collaboration are closer to those impacted. It's very similar to what my colleagues have said here. And so strengthening SRHR ecosystems, specifically for Hewlett in East Africa and Francophone West Africa, those are our regional focuses, is our primary outcome under the new strategy, and it amounts to about half of our grant making. Our grant making for the global reproductive equity strategy is about $20 to $25 million a year. So I want to share a little bit about, I'm going to get to answer the question of what does it take? But first to talk about what does that mean? So in this first year of implementing our strategy, ecosystem strengthening has taken many forms. One is shifting funding from global headquarters of reproductive health service delivery, research and advocacy organizations to their regional and national offices. We've also expanded core support to Indigenous African research and advocacy organizations who are advancing SRHR, both through direct funding and, because Hewlett has a lean staffing model, also through intermediary grant making. And then the third area is something fairly new. We're also fostering new partnerships with feminist movements and women's rights organizations who are well positioned to drive progress on SRHR and justice, but have been highly under-resourced, typically by reproductive health funders. So this is some of the how of what it takes. But where we are now is we are working with a team of evaluation and learning partners who are both based in the region and also here in the U.S. to really think through with our grantee partners about what it takes. This morning we had a convening of our partners. Tamara's there with us as well with other peer funders to ask these questions. It's ecosystem strengthening, measuring that, assessing that is difficult. For many reasons. One, traditionally, how we think about progress and impact is asking individual organizations to assess their individual progress toward shared outcomes. What we're doing now is trying to say collectively, what does it take? How do we foster collaboration amongst organizations who have often felt that they had to compete for scarce resources? Now we really want them to collaborate, to give them flexible funding, to say, in order to be able to strengthen the ecosystem and be able to meet these shared goals that we have, it's going to take beyond people working in their individual silos. We need more collaboration. Also, I think what's really important in how we're thinking about ecosystem strengthening is that not all actors are going to collaborate. We've talked a lot at Hewlett over the last few years around, we have funded research for many years. Sometimes that research is divorced from the evidence users like advocacy organizations or even governments. It is scientific journal articles that really sit on shelves for many years. We have been trying to foster collaboration between researchers and advocates. But in other ways, actors within an ecosystem are working in more complementary ways. So instead of collaborating directly, it's having the knowledge of who else is in your ecosystem is working on issues to advance reproductive freedom. How do I understand the work of those different actors and understand how my work might complement so that it's not duplicative so that it's not in competition or contradictory to one another. If we are going to administer of health together with evidence, with advocacy messages, it's really important to understand what others in your ecosystem are doing. How can you possibly partner and collaborate with them, but at the very least, understand what they're doing and to be able to learn from that. So these are some of the things that we are trying to broach in understanding how to both strengthen ecosystems and also assess progress of what that looks like.
Right. I mean, and I would have a follow-on question to that, but let's move on to Anne and a few others, and I will come back to that. And in your initial introduction, you talked about the heavy investment of PMGF in contraceptive R&D as a major part of your new strategy. How many methods would have been developed or introduced during the life of the strategy, or is this more or less a long-term play, say over a 10-year period?
It's a great question, and it's somewhat difficult to answer. Let me start by saying it's roughly 30% of the overall budget, so it's approximately $80 million a year that is spent on contraceptive technology R&D, and that makes us one of the largest funders in this space. This is an area where you'd think pharmaceutical companies invest a lot, but many of them do not. There are some exceptions, and some of them are represented here at this conference, but many pharma companies do not invest, and I could have a whole dialogue around why I think that happens. The fact that a lot of pharma companies are headed by men is one of the reasons, I'll just say that. But I think the key areas that there's a strong theme, not an exclusive theme, but there's a strong theme around investing in and helping to develop methods that fit under the category of self-care or self-managed care. So methods that women would be able to access and use on their own without having to rely on going to a healthcare provider to, insert or place the method, as the case may be. It's challenging to work in contraceptive technology R&D because the requirements around clinical trials are very rightly rigorous and demanding. These are methods, these are drugs and devices that are being tested on healthy women of reproductive age. The risks, and this is one of the reasons that pharmaceutical companies don't invest as much in the concept of technology R&D, because it takes a long time to be able to prove the safety, the efficacy of the products. So that's some of the scene setting. Briefly, some of the products that we're working on that I think have real promise. One of them is a once-a-month oral contraceptive pill. One of the key challenges with oral contraceptives is the challenge of remembering to take them every day. So a once-a-month pill that would then allow for some bleeding, that would then remind the woman to take the next pill, would be, we think, a very promising product. And again, that user insights research that I talked about last time demonstrates to us that that's one of the most popular methods that women react to when it's described to them. Another is we already have a self-injectable contraceptive that's on the market, which is good for 3 months, so looking at developing potentially a 6-month self-injectable contraceptive that again responds to some of the preferences that women have expressed who are looking for a method that is less than a year but longer than 3 months in duration. We're also looking at microarray patches, so it would be a small patch that's almost like a Band-Aid that women would place on their arms and then peel it off, and then there are very, very tiny projections, is what we're calling them, not needles, that would then administer the hormonal contraceptive into the arm, and then that would have an effect, and the duration of that would vary. We're still working on the R&D. All of these methods, however, do take a long time. So we're looking at the 6-month injectable, the once-a-month oral contraceptive are probably the fastest, but even with those, we're looking at 8 to 10 years before they have approval and hit the market. So this is a long-term play for us.
Great. Thanks, Anne, for clarifying, because I think it's exciting to hear that we're looking at new methods, but then the timeline is not probably what maybe many of us think of. But thanks for that. But it's good to hear, and it's gratified to hear that that work is going on. And it's really worth investigating as to why our pharmaceutical companies do not invest that much in there. Very interesting conversation around that. So Miles, I'd like to, very interesting in terms of your foundation's work in health and in climate change. I'd like to, that ICFP, you're known as a climate change funder. And how do you bring your health and climate work together?
Yes, good question.
Were you wondering where I was heading to?
Yeah, I was wondering where you were heading.
Okay.
Thank you for that. Yes, so ICFP is one of the largest foundations investing in climate change and the largest outside of the US. And that work does represent about half of what the foundation focuses on. We have a long-standing focus on climate mitigation and holding firm to the Paris Agreement is core to our belief and our strategy. And that means reducing carbon now. And the climate crisis is one that is top priority for how the foundation strategy is moving forward. That said, the climate crisis does mean that we are taking a closer look at climate resilience in a just energy transition. And we are making the case for investment in ways that link the advocacy and financing case for climate as it relates to issues such as strengthening health systems for climate resilience, for investing in food security, food systems that are climate resilient. But perhaps most significantly, the work needed to make the global financing architecture more just and more equitable. And that reform is something that we're passionate about. There is momentum, there is tremendous leadership that we want to champion and get behind. For our work in SRHR, it means that some of the fundamental weaknesses that exist in our financing landscape we can work to fix those on a case-by-case basis, with a degree of short-termism in mind. But actually, what we do need to do is fundamentally change the system of financing. That said, what needs to happen today remains a top priority for us, and the work that we'll be doing going forward will see us invest more in thinking around sustainable, country-led financing solutions for equitable access to SRHR commodities, closing the financing gap that exists for SRHR commodities, and making access to choices one that does not discriminate on the basis of ability to pay. So those will continue to be very important priorities going forward.
Thank you, Miles. CLD, so your foundation has done quite a lot over like 2 decades and more, and in the Philippines. What do you think the future of philanthropy for FP and RH is in the Philippines?
So a lot of Asian philanthropy, it's very family-based and culture-based. So it's quite different from, let's say, philanthropy done in Africa or in Americas or in Europe. So like a lot of philanthropists in Asia, and especially in Southeast Asia, philanthropy for reproductive health and family planning is very conservative. it reflects on the philanthropist's individual and family values, and also depends on the branding of the organization or their company. So understanding how reproductive health and family planning can be branded with reference to how Asian countries and Asian values are is very important. We've worked with partners who are actually very vocal consensus objectors to reproductive health and family planning. And they have mentioned us in a lot of instances that we do not want to dabble with modern contraceptives because it does not reflect our brand. It does not reflect the family values. So with that, it's very important to be able to understand how they work. Also, understanding what are the common integration points. So even if you don't agree on modern contraceptives, everybody almost agrees on issues addressing maternal and child health, universal health care, and everybody understands what needs to be done. So this is where complementation of resources and leveraging is very important. And for this, in the Philippines, there are a lot of partnership networks, convergence networks already on universal health care and public health. So even if the members of these networks may not really agree on reproductive health, when reproductive health is bundled with issues of climate change, climate resiliency, especially in the Philippines, is very vulnerable to climate disasters, especially when we talk of nutrition security, universal health care, and primary health care, then reproductive health changes. It's not now on the method, because a lot of issues and contraceptives is really on the type of method that's being espoused by the organization or by the government. But it becomes already an issue of how do we bundle resources together to address common issues relating to universal health care or climate resiliency, as Miles have mentioned, or even in terms of financing for primary health care services. So I think the future of philanthropy, especially for Southeast Asia and even Asia, is really looking at leveraging and complementation of resources.
Absolutely. Very good point. Thanks, LD. Tamara, I have two questions for you. They're connected. What should we, as a global community, have our eye on? And what keeps you up at night?
Oh, those are connected. So I'll say a few things. I think as a global community, we need to think about going the last mile, about equity. I think that's on all of our minds, so that's pretty exciting. And we have to think about how we keep this movement alive and how it endures. So I think it's very easy. We are a culture of things happening very quickly, really a global culture, and wanting to do something new and find the new thing. And yet, we've got to stay the course. We've got to stay the course for women. We've got to stay the course for young people, people in general. And so how we keep people's attention on these issues, keep them in government's budgets, keep it in public policy, keep liberalizing public policy, I think is critical. That's coupled with a keen worry about the opposition. Most of it comes from the US, and most of it is heavily, heavily well-funded. And we're seeing it emboldened because of what just happened in the US with the Dobbs ruling. And so I think we don't want to backslide. And we've really got to keep our eye on the prize of women's lives, of young people's lives, and of their experience and their needs, and how all of this, how reproductive health informs the rest of their lives and interconnects with their economic security, with their educational success, and really ultimately with our global well-being. So those two things together, the enduringness and how we keep our eye on the opposition and don't let them get ahead of us, are really critical. And then finally with that, I will add stigma. I think there are so many ways we stigmatize abortion, we stigmatize contraception, we stigmatize messages around sexuality, sexual pleasure, and we as a global community have got to shift that. Everybody likes to say, oh, we're the most conservative place. We see that in the United States, we see that every place we travel in the globe, and yet we've got to start changing our narratives so that we aren't stigmatizing the things that are most critical to us.
Thanks so much, Tamara. So permit me, and can I come back to you on just to learn a little bit more about how do you leverage partnerships with other foundations, donors, so that synergies are achieved for mutual goals? And Sildy did talk more about the importance of leverage in their system due to private corporations' position on certain things, etc., and especially in an area like reproductive health. It would be interesting to hear how the Gates Foundation is leveraging such partnerships in your space, and what are your main criteria in developing those strategic partnerships?
Thanks, Kojo. It's a broad question, so let me just try and hone in on a few fairly concrete examples. One is, and Miles has referenced this, we do lean in on the issue of it sounds very dry and very boring, but the commodity ecosystem for family planning, other reproductive health products, right? Women and girls can't exercise their right to decide on the number, timing, spacing of pregnancy if they don't have access to contraceptive products. Okay, there are some methods that don't require products, but for the most part, products are required. And so there needs to be, it's a complicated system, right? Women and girls are, it's a whole lifetime, or it's a whole reproductive lifetime of 25, 30, 35 years that women and girls are susceptible to the risk of unintended pregnancy. But their desires, their life situations vary dramatically during that time, and different types of products, they need access to different types of products during that time. We need to make sure that at every level of the health system, including the private sector, that women can access a range of products so that they can decide, make a fully informed choice about what product is best for them. So we work with CIF, we work with USAID, we work with a number of other partners, also UNFPA, for example, on that sort of commodity, the health and functionality and efficiency in that commodity ecosystem. I know that feels a little bit dry. Another key area that we work in is on partnerships to ensure that we have a consistent, strong voice to champion sexual and reproductive rights, including, of course, access to family planning. So we support FP 2030, which has been a key player at this conference. We support the Ouagadougou Partnership. If you saw Marie Ba in the morning session on family planning in UHC, the Ouagadougou Partnership that she coordinates is a key funding partner for us. You know, I think it's we have in the family planning field talked for many years. We've used this tagline that family planning saves lives, which is true. It helps to prevent high-risk, closely spaced, et cetera, pregnancies, and helps to reduce maternal and newborn mortality. But I think as a community, as a movement, we really need to shift or expand our mandate to talking about how family planning transforms lives, that these issues around enabling girls and women to understand their potential, to achieve their full potential, to complete their education, to engage in economic activities, all those things are enabled by family planning. One of the changes that happened at the Gates Foundation following our strategy refresh, which I haven't actually mentioned, but again, those of you may have seen Anita Zaidi, the president of Gender Equality at the Gates Foundation, who spoke on this morning's panel. Family planning is now was moved into that Gender Equality division in July of this year. And I think that is emblematic and symptomatic of that shift that I'm talking about, that I think we, you know, if we want to sustain energy and creativity and enthusiasm around family planning and sexual and reproductive health, we need to really anchor to this message of family planning and sexual and reproductive rights are fundamental to enabling girls and women to achieve what they have the potential to achieve. Thanks.
Thanks, Anne. Althea, coming back to you, in your strategy, you talked about power shifting. Can you throw some more light on that in terms of how this has evolved under that new strategy, and how there has been an emphasis on power shifting over the years, but then how is it coming out in this current strategy?
Thank you, Kojo. I feel like in the last few years, there's been so many conversations. I mean, power shifting is now obviously like the buzzword. And we had an opportunity, again, because I think of the pandemic, to really like interrogate what would that actually mean in a strategy around our goals, around our outcomes, how we approached a strategy refresh process, how we developed a new plan for learning for the strategy that we developed. And so power shifting has taken many forms. I'll start with a strategy refresh, and then I'll start with actually the implementation. So in the strategy refresh, as I mentioned before, because we had an opportunity to have people join virtually, we included many people within the regions that we work who had not been involved in our strategy refresh processes previously into our process. We also ensured that we had people from the region in which we were working be the consultants on our strategy refresh. That was also an evolution in how we worked. As you know, Hewlett is a development funder. This is not how we had worked previously. And so having people from the region who had lived experience actually help develop the strategy was something that was really kind of an innovation in how we worked. From that, we then have our new strategy. The goals and the outcomes really reflect the focus on ecosystem strengthening is about how do you shift resources and decision making to those closest to the issues. What that has looked like, in some ways it is direct funding to, for us, African indigenous organizations, research organizations, advocacy organizations, movements. But because of our lean staffing model, that's not always possible. So we work through several different types of intermediary grant-making processes. Some of them are international NGOs. We are now working with women's funds who also do onward grant-making. And we think about power shifting in that as saying, if we were Hewlett providing direct funding to an organization, we would give technically, most of the time we give general operating support or some type of flexible program support. But in an intermediary model, we're really trying to interrogate if an onward grant-making partner is providing that same level of flexibility, that same level of trust in those types of partnerships. It has been a lot of work to try to rethink what does this level of kind of trust, flexibility look like in these types of intermediary grant-making relationships. But it is a form of power shifting. A lot of emphasis, I think, has been focused on philanthropy. We need to shift more power. But the truth is, power is multi-leveled. And so this interrogation is looking at many different actors in the ecosystem and how we work together. We've brought onward grantees into the proposal development conversation so that they know the full envelope of what we're offering for a particular initiative that they're working on collectively. We provide interpretation services so everyone can very frankly and transparently have a conversation about what the priorities are, who's making the decisions about what those priorities are, what type of transparency we have around budgets, is there equity in how resources are allocated amongst partners. These are real critical aspects of power shifting that we are really diving deep into. And so that is an example.
Thank you, Althea. So I'm looking at the time and we have barely 15 minutes left. What I'm going to do is to end the audience. I really did wish that we could have an opportunity to have you ask questions, but I still have a few more to go. So let's see how we go. So to Miles and Zildi, I have questions for you. And then I'd like to have a wrap-up statement of about a minute from each one of you, assuming that you can really see into the minds of the folks sitting here and seeing that what other questions are not answered for them coming from your side, and just use that minute to be able to wrap up for me. So with that, Miles, can you tell, CIF has always had a strong focus on adolescents and youth within your approach to SRHR. How is that changing?
Okay, so yeah, I'll be quick here. We remain completely committed to investments that are designed with adolescents that have adolescents and young people at the heart of both design and delivery. That has been a constant, and that won't change. The exciting news is really that we want to go far deeper. So we recognize the crucial role that sexual rights and reproductive rights for all play in the lives of young people, and how they are shaped by the next generation. We also know that these need to be seen in a holistic way around those lives, as empowered individuals with agency over their own bodies, over their own decision making. What we need to do, what we've decided is to position more of our SRH programming as it relates to young people in a framework that we call Girl Capital. So this really tries to put young people at the center and really aims to connect the work that is vitally important as it relates to their health with that transition to adulthood in a more comprehensive way. So the work that is needed on skills, on education, on livelihoods to support a productive transition to adulthood. This has been pioneered locally by our local partners, notably in India and subsequently across East Africa, and this will be a powerful feature of our work going forward. And I think at the heart of it is a belief in empowerment and really supporting that framing in how we look at adolescence and youth. What does this mean for our sexual and reproductive health work? Well, young people should be a priority of any funder investing in sexual and reproductive health. Boys, girls, young men, young women, these must be a priority population for. They continue to be an absolute focus of our equity lens as we frame our programming, and we evaluate each of our investments against that lens. So in that respect, there's no change. We're deeply committed to working for, listening to, and understanding better the lives of young people.
Thank you, Miles. So Seldi, you talked about leveraging and working with other foundations, etc. Just in a very short statement, can you throw some light on some of the strategies that you're taking to engage partners for skill? I mean, skill is the buzzword in the work that you're doing, and everywhere really. Scale up is everything. But what are some of the steps that you're taking by way of your strategy to engage partners in that space?
So for the foundation, we do a lot of work on leveraging our expertise and mainstreaming our work. So often we are said to have been giving away our technology to our partners, but that's really the way for us to mainstream how we do with our academic partners, with local government units. Our foundation does not receive grants from government. So even if we do receive grants from bilateral and other development partners, our guidelines do not allow us to receive funding from government. And so it's very critical to engage partners and to leverage and do a lot of complementation. Also, as the Philippines gears towards the full implementation of the devolved local health systems and universal health care, it's critical that we work in platforms that look at integration of primary health care services, including and most especially reproductive health and family planning, just to make sure that governments do not see reproductive health and family planning as programmatic interventions, but as key really in terms of how universal health care should be implemented. I'd also like to note that for a lot of us, especially for us in developing countries, a lot of philanthropists are very hesitant to work with local governments. And a lot of us are also familiar with a lot of programs that are heavily investing in technology and systems, but not really working with governments, but in the end, at the latter phases of the program, expect governments to sustain at the same level that they have implemented. So for us, it's very important to engage local governments as key partners at the onset and ensure that they're able to utilize the resources that are being provided to them and exercise really their political mandates to allocate these budgets and resources to ensure that services are equitable for everyone.
Great. We're almost at the stage where we would have those summaries, but Tamara, there's just one last question that if you can really touch on for me. What would you say is critical in the funding work, okay? And what would you tell new funders?
What would I tell new funders? So I think, first of all, I would say define your values and spend a lot of time listening. You know, certainly listen to us, but more importantly, go out into the world and listen. You know, my vote would be listen to young people, listen to women, go deep into communities and try not to impose. I think that's always a tricky thing because we want to respect people's time and we want to respect where they are in their lives. And at the same time, the more we can listen and learn about the context that they're living in, I think the more good we can do. So define values, understand context, listen closely, look at evidence, know that evidence changes all the time, so keep looking at evidence, and then figure out what you're passionate about. So, you know, I think much of philanthropy is an art, not a science. There's no scientific way that you say, you know, go to this place, don't go to that place. So what excites you as a philanthropist, and where do you want to go? Where do you like going in the world? And, you know, it's not a bad choice to go there. And then I think you also have to think, do you want to go for the hardest, the most challenging? And that can be defined in a lot of different ways. Or do you want to go for low-hanging fruit? And do you want to do something like contraceptive technology, which is pretty exciting? Or do you want to really get into a community and work with the people, or some of both? Do you want to change systems, or do you want to change life by life by life? So those are some of the questions I would ask. And also know that one can change one's mind.
Great. Thank you, Tamara. So for folks, it's about connecting the dots, right? So we're hearing from those that have been in the business for some time. We're also hearing some advice as to those that are coming in new. And then for those of us that are implementers as well, looking at from their angle into our world and seeing how to connect the dots. So to wrap up, can I get from you that 1 minute statement or thing about your work and what you feel as audiences should know about philanthropy and funding? So Althea, I started with you. I'll start with you again. So just give us about a minute of that.
Kojo, I'm going to answer that question, but also give you my call to action. I think what I've learned from this conversation is that one of the things that really matters in philanthropy is the quality of our partnerships. And that is both the partnerships amongst us as peer funders who both collaborate on some initiatives, but also, as you've heard, really have very complementary ways of working. in terms of the focal areas, in terms of the strengths, as Ann said, in terms of our niche, and then our partnerships with grantees. These things we continue to need to cultivate really strong partnerships, transparent partnerships, ones that are built on, trust and humility. And I think as funders, this is something that we continue to have to kind of work on in partnership with each other and with all of you to really investigate, like, what is the quality of these partnerships and how do we continue to cultivate ones that are strong and that really help us to advance our shared vision of reproductive freedom.
Great, thank you, Althea. So, Anne, what would you some folks out there have some questions about how BMGF is going about this, and they probably didn't get their questions asked by me. What would you say? What do you think is out there that they would like to hear in a minute?
I think, being philosophical for a minute, I think what I would say is a critical characteristic for all funders, and certainly something that I strive, and that is something, because I'm relatively new to philanthropy, right? I've been in this role for less than 3.5 years. And I think it's to be humble, to be curious, and to always be looking for the unexpected. Never think that you know the answer. You always have to, picking up on what Tamara said, you always have to be listening. You have to be looking at the evidence, at the hard evidence, at the analytics, and that does change, but that gives you answers about what works and what doesn't work. And I will tell you, I have thought things that when I was like, oh, this is going to be the answer. And, a fair amount of the time, you've been in the field for a long time, the evidence does come back and supports what you thought the answer was going to be. But sometimes it comes back and you're like, I was completely wrong on that one. Oh, boy. So listening, looking at the evidence, and coming at these issues with humility and curiosity.
Brilliant. Thank you. Miles, I guess it's your turn.
Yes, super fast. So it probably hasn't escaped the audience's notice that most of the questions have been planted with Kojo. They're the questions we wanted to answer. And I'm sure if we asked you what you'd like to ask us, there'd be tougher questions maybe. I want to say, Sif and myself, we're beneficiaries of, we're here because of unearned privilege, and we're beneficiaries of structural inequality. And foundations are, by their nature, pretty unaccountable as well. So I would encourage you to ask the hard questions of us. I'm sure some of you are thinking, how would we work together? What would be the approach that works best for these foundations in terms of what you're looking for? I'd turn it around, actually. I would hold to your principles. I would really approach us from the position of strength, and I wouldn't be afraid to ask us tough questions, at least as it relates to SIF. Thank you.
Super. Thanks, Miles. Well, that was a round of applause. I think folks like that. Okay. All right. Thanks. Seldi, what will be your final say?
Yeah, I actually learned a lot from this session, and I think I got best from what Tamara said. It's really having the evidence and the context, and similar to what Ann said, it's listening. But also, it's really how do we learn as funders, as philanthropists, as organizations that implement philanthropy, how do we learn, and how do we learn with our stakeholders, with our partners. And I like what Miles said about accountability, because we have to hold ourselves accountable for not only for the funds that we implement or that we hold, but also for the outcomes that we are set out to implement. And I think this is where Althea's statement on power shift really comes in. How do we hold ourselves really accountable to ensure that outcomes are seen based on the work that we do? And at the foundation, I think that's the thing that we ask ourselves every day, and we drive ourselves to answer every day as well.
Super. Thanks, LD. Tamara, you have the last word.
Oh, boy. Well, I was going to say humility and curiosity, so let me build on that. I remember not being a funder and seeking funding, and I always felt like there was this big cement wall, and the funders were over there, and it was a big mystery. And we try not to be that way. I think we try to be less and less that way. But what I will say is that we too are always looking for a good idea, for an innovation, for something that's bold. And so don't be scared to question philanthropy. As Miles said, we need to be held accountable. But also don't be scared to bring us an idea that you think, is that really a fit or does that really make sense? Because we're always looking around the corner. We ourselves are curious. I think otherwise we wouldn't be in this business. And I think my final word, since I have the final word, is to be ambitious on behalf of women, on behalf of young people, and on behalf of reproductive health, and be bold.
Great. I mean, this has been a fantastic discussion, and for myself as an implementer on the other side, it's been very enlightening. And I remember in the preparation room before we came, I talked about the fact that what is really behind the curtain that we don't see. I mean, Tamara, you called it more behind a blog. But I think that is how those of us working in the field, etc., wonder whether there's a mystery behind that curtain. But folks, I mean, as you've seen here, really, there is really no mystery to it. And also that there really is no curtain. Our panelists here have been very open and transparent about what it is that goes into their thinking and their strategies and what it is that they're looking for. Really, the whole objective is about a better world and a better way of doing it and reaching the most vulnerable and making sure that where there isn't access, there's access, and where there's inequities, we really fill it out. And so I think to us, and I now speak from our side of the curtain, I mean, there's no curtain, but really for us is to be ourselves and also to be true to ourselves as to what it is that what we're doing out there and why we're doing what we do, and connect with that same spirit of transparency and openness and really a sense of purpose. And I believe that we can all together improve or make the world a better place. So with that, I'd like to say a big thank you to our distinguished panelists here. This has been fantastic. I do hope that that open conversation goes on and we'll find ways and platforms to make sure that we can create better or stronger engagement between those on the other side out in the field implementing and you as philanthropists, funders, and corporations. Thank you again. And thank you for being such a great audience.